Hello everyone, my name is Dr. Zaraharaddin. Today I'm going to discuss about lower back pain. Lower back pain can be defined in different conditions such as age, weight, and posture. Age starts around 50 to 60 years due to the X factors. All the vertebral body, as you can see here, it will be weak. Around the vertebral body there is cartilage bone inside, and the cartilage bone will be brushed, and the intervertebral disc is going to be weak due to the vertebral body has been weak. So the synovial fluid that was inside, it will be squeezed, and it will tight, and the bone will tight the intervertebral disc. So due to the X factors, this used to be happen, and at that time that this happened, around the lumbar L1 to L5, inside your L1 to L5 is going to start, you are going to start feeling pain little. So this used to happen due to the X factors. Then the weight, that is overweight lifting, like those who used to go gym. When you went to gym, you take a dumbbell in the ground, take it off toward your chest. During the time that you just raise it toward your chest, you will start feeling a pain. You just raise it toward your chest, you will start feeling a pain in your lumbar side due to the weight or age. Still, it can cause due to the age, because some people, they used to take a heavy lift that is over their age. So this used to happen due to taking something that is overweight. Then Foxshow is divided into five stage. We have normal, and we have lifting, then we have kyphosis, scoliosis, and lordosis. So in scoliosis first, you will see the Foxshow of the vertebrae, it will bend internally without physical appearing, such as like this. It will be like this. Then in lordosis, it will be inward. The vertebral base will be inward, like it will be inward. It will be like disorder of the vertebrae, when the vertebral body and the cartilage with the muscles that is attached inside will be weak. There is stiffness of muscles, and there is the ligament, there is injury in ligament and tendons still. Then the kyphosis, it will affect the thoracic cage. It will appear in like outward, which is concave. It will be like this. You will see some patients, they used to feel pain in their backside. So this used to happen sitting, they are standing without moving or anywhere, they used to keep standing. So definitely the time that you feel to go somewhere, or you feel to just move from this side to this side, from one object to another object, so you feel some pain still. It can cause lower back pain, even this thing. Then we have spondylosis. There is cervical spondylosis and lumbar spondylosis. Cervical spondylosis used to occur due to the overweight or overload, more especially in industry or company. It can happen when you take a heavy things in your head. So definitely the time that you take something from this cervical, we have C1 to C7, as you can see here. Maybe the pain come across to C1, so it will touch the intervertebral disc. When the pain touches the intervertebral disc, due to the synovial fluid that was inside, those fluid, they are surrounding there, they are moving. So when you take something that is too heavy, those fluid, it will squeeze the fluid that is inside. So when it squeezes the fluid that is inside, the cartilage bone that was inside, it will brush and it will attack. So after it takes a long time without treating or taking some action about it, it will come across to the lumbar side. Then definitely it will affect the lumbar side. All the pain used to come down to the lumbar side. You will just feel pain still in that side. And the lumbar spondylosis, the kyphosis, it will affect the thoracic cage. It will appear in like outward, which is concave. it will be like this. You will see some patients, they used to feel pain in their backside. So this used to happen in the kyphosis also. Then there is ergonomic. Under ergonomic we have like sitting, standing, walking, and spondylosis still. So in sitting, as you can see, sometimes during the office, some people used to sit in the office. For more especially, they are busy using computer. So definitely the time that you are busy using computer, you are typing something or doing something else, you take at least like 10 to 20 minutes without moving your muscles or without moving anywhere internally or laterally. The pain is the time that you finish, you wake up, you will feel some pain in your lumbar side, like in the back, in your L1 or L2 or L3 to L5. Still you will feel pain. So this used to occur due to this thing, typing or working in office. By standing, as you can see, some people, they used to work in maybe ATM machine or like army forces or something like that. They used to take like long time. They are sitting, they are standing without moving or anywhere. They used to keep standing. So definitely the time that you feel to go. And the lumbar spondylosis, if the condition take a lot of time without treatment, so it will now affect the lumbar side. Then we have compensation. Compensation means transfer weight from right side to another and to the left side. Maybe for example, we can say bending internally without appearing physically. Maybe right side is affected area and the left side is non-affected area. So as for example, let me give example as when you are driving a car. You are driving a car, definitely during the time that you are driving a car in the road, maybe your tire has get patched. So definitely the time that your tire get patched, you have already sepia in the boot. So you just park in the site to bring the sepia and the other equipment that you are going to remove it. So assuming the sepia is small one, so you put that sepia. It can take it is going to be. It is going, when you put that sepia tire inside, so definitely the time that you finish you operate your car, you are driving, all the weight in that side will come back to transfer it to that small tire that you put a sepia, and it will not take a long time, and the other side will affect. So that's what we used to call compensation. Then in our next episode, I'm going to talk about